Reaction is pouring in after a CBC News report that hundreds of patients may have been exposed to blood-borne infections at a Toronto gynecologist's office due to tools that weren't properly cleaned. Dozens more patients have since reached out, sharing their negative encounters with the doctor. Talia Ricci has more from one patient who filed an official complaint, as well as tips from a medical malpractice lawyer.
Sandra Cole, a former patient of Dr. Esther Park, stands outside the clinic with a sign. Public health officials are warning around 2,500 people may have been exposed to bloodborne infections at the office, citing issues with cleaning medical tools. Her goal, to warn patients and demand accountability.
We need to start exposing these doctors, and we need to start exposing the College of Physicians and Surgeons' lack of accountability once and for all. It shouldn't take hundreds and thousands of complaints before something happens. It should be one complaint should be good enough.
That sentiment is shared by Rachel Malanta, who filed a complaint about Park to the College of Physicians and Surgeons of Ontario in 2021.
When the doctor came in, she stood in the doorway, did not close the door. We couldn't have been more than, say, 20 feet away from the lobby, the waiting room where people were. She started asking extremely personal questions. She said to get undressed, and I asked for some sort of covering, whether she had a sheet or anything of that description, a gown. She said, no, I should have brought it from home.
Malanta said after the doctor left the room, she closed the door herself and covered herself with her own tights.
The issue I was there for was purely external. So at no point did I consent to any form of internal assessment. And I'd also explicitly said that I was not there for a pap smear. She went between my legs, put her laptop to the side, and the next thing I felt, with absolutely not a word, I felt something get put inside me. I jumped up in pain because this hurt a lot.
Malanta says she was given a prescription and no further information. She says she was bleeding for days afterward. After a tearful call to her mom, she says she put everything in writing and filed an official complaint. She was unsatisfied with the response, which included Park refuting most of her claims.
Calling it a slap on the wrist would be an exaggeration. It was nothing. It was basically saying we recommend she does a communications course. I just wrote a long Google review hoping other people considering seeing her would read it, and left. I told everyone who would stand still long enough to listen.
The College of Physicians and Surgeons of Ontario says it's investigating Dr. Park in relation to infection control issues in her practice. CBC News requested an interview with the college, but they declined. We also asked for the number of complaints filed against the doctor, and the college said they couldn't provide that information, citing confidentiality restrictions. Dr. Park's license is currently listed as restricted on the college's website. This medical malpractice lawyer says if a patient is not satisfied with a CPSO decision, there's also the legal route.
So if a patient feels that the complaint process hasn't gotten them the resolution they were hoping for or the closure they want, a lawsuit can be sometimes a better option because it is more focused on ensuring that there's the recovery for the plaintiff themselves for the specific damage they suffered, as opposed to discipline to the physician that won't necessarily amount to anything for the patient. As long as everyone gets tested, and then if they do have questions about their rights, they should seek legal opinion as soon as possible and just make sure that they're aware of their options and they avoid any issues with limitation periods.
Toronto Public Health says the office corrected the infection control issues, but for patients like Malanta, her experience with the doctor has stayed with her.
It was, without question, the most traumatic experience I've had with any medical professional, possibly anyone at all.
CBC News contacted the clinic, and a staff member said Dr. Park will not be providing a comment. The office's answering machine states the doctor is retiring and the clinic will be closing in April. Talia Ricci, CBC News, Toronto.
New documents reveal the province is aware of the risks associated with removing bike lanes in Toronto. The more than 350 pages show the Ford government knows that its plan may not achieve its aim of significantly alleviating congestion and could actually increase collisions. Lane Harrison takes a look.
If you listen to the leaders of this province, you might think the only thing standing between Toronto and roads free of traffic are these bike lanes.
Our government will get traffic moving again by making sure we remove these silly bike lanes.
They're taking up one lane of traffic. They're backed up from here to Timbuktu. Just watch how quickly we get those bike lanes out of there.
But behind closed doors, the government acknowledges many of the criticisms facing their recently passed legislation, which would see bike lanes on Yonge, Bloor, and University ripped out. That's according to hundreds of pages of internal documents, recently made public as part of Cycle Toronto's court challenge against the bill. One cabinet briefing note says the plan may not do what the Premier promises. Quote, given that current data and research does not confirm that removing bike lanes that occupy a lane of traffic would significantly alleviate congestion. And an engineering report commissioned by the province says removing bike lanes could lead to a 54% increase in collisions, though the province has discredited the report as, quote, high level. Those taking the province to court, including a cyclist recently injured by a car door, say the documents validate their message.
Removing these bike lanes will put people's lives at risk, and not just people riding bikes, but actually all road users. That this is information the province has had since the beginning.
The Premier has maintained he wants to keep cyclists safe.
Bike riders are important. Go on the secondary roads that run parallel, a few feet away from the existing roads.
The province promising those parallel routes will be made available, but its own staffers privately raised doubts about that plan. In a December email exchange, one says cyclists often stick to the quickest routes. And, quote, while I understand that there is messaging about the secondary roads, the extent to which that could be achieved and used in Toronto, for example, is an unknown/unlikely.
I have, visited many business owners on Bloor Street.
Another dimension of the province's bike lane messaging is a claim they hurt businesses. But what does the internal briefing say? Quote, evidence shows that bike lanes have a positive economic impact on local retail businesses. After a hearing on the court challenge this week, the province's lawyer said he will have lots of evidence to argue Ontario's side when the challenge has a hearing in April. Lane Harrison, CBC News, Toronto.
The City of Toronto is in the process of doubling the amount of automated speed enforcement cameras. As Dale Manukduk reports, it's just one of the tools that the city is using to address speeding and change driver behavior.
The odds of picking up a speeding ticket during rush hour is slim with cars so close to each other. But at any other time along Parkside Drive, this automated speed enforcement camera has dinged thousands of drivers for speeding infractions.
There's been lives lost on this street. There's lots of speeding. It's a community safety zone, but if you look at the design of the street, nothing about it screams safety.
Automated speed enforcement cameras first rolled out in 2020. This year, the city is doubling the amount of ASEs from 75 to 150.
We're well on our way to completing the 150 cameras. And an interesting thing about the new 25 of these new cameras are going to be permanent pole-mounted cameras. So
those will be fixed along streets where speeding is a big issue. The rest rotate around. The city posts street signage and lists the locations of all the cameras on its website.
It's a provincial requirement that we're transparent, right? So the signs have to go up 90 days in advance of us putting in a camera to let people know where they're going to be. And so we have a rotation where when we're going to move the camera, we have to put the signs in the new location 90 days in advance.
Since they were first installed, tens of thousands of tickets have been issued. Sick Kids did an analysis of the program to measure its effectiveness.
A pretty thorough assessment of the program is deployed before we added the other 75 cameras, that it was having a measurable impact on speed. And I think they also believe that it probably has a little bit of a halo effect when we move the cameras around.
This road safety advocate says more needs to be done, especially on Parkside Drive, which has consistently been one of the roads with the highest number of infractions.
When you have a street that's designed like an urban highway, a speed camera is not going to cut it. And that's what the data has been telling us for a couple of years now.
The remaining 15 cameras will be installed by the beginning of April. Dale Manukduk, CBC News, Toronto.
The fight for long-term health care reform has hit a major snag. The Ontario Health Coalition says due to lack of funds, it will not be appealing court rulings in 2 cases, including one in favor of a law that allows hospitals to move patients to long-term care homes not of their choosing. Ali Chiasson reports.
Advocates from the Ontario Health Coalition challenged the Ford government on two fronts. One is the Bill 7 Charter Challenge, which is the requirement that hospitals charge elderly patients $400 per day for remaining in hospital if they refuse to go to a long-term care home that is not of their choosing.
It allows them to be forced out into long-term care homes that are not of their choosing, up to 70 kilometers away.
The other court challenge is about the care home Orchard Villa in Pickering, getting a 30-year license extension despite having one of the highest death rates during COVID.
Under the law, the government is not supposed to issue new licenses to companies that have terrible records. So we took it to court. In both of those cases, we lost.
The Superior Court ruled that the Ontario Health Coalition isn't a judicial person and therefore wouldn't have standing to even challenge the Orchard Villa expansion, a win for the Ford government's maneuvering on the matter. Quote, the minister and the director clearly took the submissions made in the consultation process into account in their decisions, even if the applicants did not obtain the result they wanted. The gavel also smacked in favor of Bill 7, the $400 per day penalty for staying at a hospital, for refusing to move into a long-term care home, sometimes many kilometers away. Quote, this is a modest economic consequence of the patient's decision to occupy a hospital bed that the patient no longer requires. The consequences of Bill 7 are not serious. So what's next?
We're not appealing because we can't afford to appeal, frankly. That's just the bottom line. We'll have to continue and just ratchet up the pressure outside of government to try and pressure the local MPPs, to pressure their own caucus for change.
The Ford government stands firm that their mandate is to create more space in long-term care and saw these court challenges as getting in the way of that. Quote, our government believes in building Ontario's long-term care capacity, not reducing it. Ali Chiasson, CBC News, Toronto.
The SIU is investigating after a man was tasered and seriously injured at Dufferin Mall on Tuesday. The provincial police watchdog says around 8 p.m. a loss prevention officer was involved in an interaction with a 37-year-old man. A police officer saw what was happening and tasered the man, prompting him to fall to the ground. The man was then arrested and taken to hospital where he was diagnosed with a serious injury. And the SIU is also investigating after a crash in Mississauga Wednesday morning. Halton police were responding to a call for the theft of a Kia Sedona from a home in Oakville. Police located the stolen vehicle as well as a Hummer believed to be involved in the theft. As officers tried to stop them, the Hummer crashed with a tractor trailer. The driver of the Hummer was seriously injured, prompting the SIU to invoke its mandate. A 48-year-old man has been sentenced to life in prison for fatally stabbing his ex-wife and daughter in August 2022. A jury found Godfrey Sigod guilty of first-degree murder in the death of his former wife, Elvie, and second-degree murder in the death of his 20-year-old daughter, Angelica. Police say they were both killed inside a vehicle near Bathurst Street and Ellerslie Avenue after an obvious struggle. The judge has set parole eligibility at 25 years for his wife's murder and 18 years for his daughter's. 4 people, including 3 teenagers, have been arrested in connection with several retail robberies across the city. Police releasing this video of what they're calling a high-risk takedown. 4 vehicles surround a stolen vehicle as officers arrest the 4 suspects, a man in his 30s from Toronto and 2 15-year-olds and a 16-year-old from Brampton. Officers also recovered a loaded handgun. The arrests come after an investigation into 3 robberies in the city, one in the Yonge and Steeles area, another near Kipling and the Queensway, and a third near Shepherd and Kennedy. The suspects are now facing robbery and firearms charges. Welcome back. Ontario is seeing a massive surge in measles, with cases more than doubling in just the last 2 weeks.
The vast majority of Canadians are vaccinated. However, there are under-vaccinated pockets within the country. And when you have the importation of measles, it's so transmissible, it has a knack at finding those under-vaccinated pockets and exploiting them and causing outbreaks. And that's exactly what we're seeing now. It's not the benign childhood illness that some people like to make it out to be. I mean, decades ago, everybody used to get measles, but not everyone was okay. We know it has significant complications associated with it. Even with this current outbreak in Ontario, there's about a 9% hospitalization rate. We had a measles death in Ontario last year. There's been 2 measles deaths in the United States this year. And we know measles kills about 100,000 people on the planet every year, the vast majority of them being children.
Public Health Ontario is reporting 372 cases since the outbreak began in late October, with nearly 200 of those cases coming since February 27th. And that's resulted in 31 hospitalizations, including a child who needed intensive care. 30 of those hospitalized were unvaccinated. The remaining person had an unknown status. Measles is a highly contagious virus. Symptoms include fever, a red blotchy rash, cough, and watery eyes. The number of cases reported in Ontario over the past 5 months is almost 4 times what the province saw in total between 2013 and 2023. If you look up at the sky late tonight, there's a chance you'll be able to see not just a total lunar eclipse, but a rare phenomenon known as a blood moon. Experts and space lovers are calling this celestial event special for different reasons. Brittany Billette explains why.
Late Thursday into Friday, there's a chance to see the moon go from this to this, a blood moon caused by a rare total lunar eclipse. This York University astronomer calls the stellar moment special.
Well, lunar eclipses are actually one of my favorite events. They're just so easy to see. You don't need a telescope, so you won't need this. You don't need binoculars. You can go out with your friends and just have a look. And it's a chance for everyone to share in a bit of celestial dynamics, a bit of astronomy, to learn something about the solar system, or just watch the Earth's shadow go across the moon.
First, the moon enters the shadowy outer phase called the penumbra, then moves into the umbra, the darkest area. At totality, the sun, earth, moon are perfectly aligned, turning the moon red.
The blood moon is the reddish-orange color that we see that appears on the moon during totality. And this occurs for the same reason that our sunsets are red on Earth. The sunlight passes through our atmosphere, scatters away all those shorter wavelengths of blue light, and only the longer wavelengths of red light reach the moon and cause the moon to glow in this sort of orangish red color.
Gorgeous lunar eclipses like these are a little more rare, experts say. It not only depends on the path of the moon, but also where you live. This go around, some of the best views will be in North America.
The next total lunar eclipse will happen in a year, in March 2026, but then we won't see another one until 2029.
Eclipse chaser Dr. Ralph Chu will be viewing the celestial event from his home observatory and taking advantage of winning best seat, even though he'll have to stay up late for it.
You've got to be up between 2:30 and 3:30 roughly to catch the real show. Anything before that and after that, it's not going to be very interesting.
So you'll be up late.
Oh yeah, I'll be up, and you know, for any of the kids who are out on school break, this is a perfect chance for you to stay up all night because that's what it's going to be.
A fun-filled night that means more than astronomy to some.
I think what's really special about these sorts of events is it connects us with so many different people from all different parts of the planet that we're realizing that we're all seeing the same sky, we're all seeing the same event collectively together. And I think that is a really special unifying feeling.
The eclipse officially starts at 11:57 on Thursday, and weather permitting, you'll be able to see totality around 2:30 a.m. Friday. That's when you'll have about an hour to look up at the sky and marvel at the blood moon in its best form. Brittany Billette, CBC News, Toronto.
Colette joins us now with a check on the forecast. And Colette, today started a bit cool, but that changed as we got into the afternoon.
Yeah, from the temperatures this morning, you would have known maybe how delightful the afternoon would become. We were at -4 as of 6 a.m., but look at Oshawa at -8, Peterborough as well, and nearly -10 in the nation's capital. Given a little bit of time, plus the sunshine, there was the high thin cirrus cloud, but with that sun getting through, plenty of it by 4 p.m., up to 7 degrees, and in fact, some double digits to be found in southwestern Ontario. So we're still looking at or experiencing having this split jet. A lot of this energy here to the south, though, is going to be enhancing some of the severe weather anticipated tomorrow night, but even beyond that into the weekend. Not for us here in Ontario. I'm talking about what will be happening, especially in states like Missouri and into Illinois as well, and some of these regions down towards Arkansas, and then that will move eastward as it goes a little bit deeper into the weekend. So lots of conditions there that they'll be paying close attention to. Here at home, we'll be looking at the special weather statement. This has to do with some of the rain and, yes, perhaps a few thunderstorms that will be rolling through, giving 20 to 40 millimeters of rainfall into the weekend. There's still plenty of snow melt to the north, as well as the ground being pretty solid, and so some of that could lead to some localized flooding. So that's really Saturday night into Sunday. However, in the short term, before we get to that system moving in, we do have pleasant conditions tonight, so that chance to see the lunar eclipse. And then tomorrow morning, mostly sunny skies. Again, some cirrus clouds showing up. That's just that high thin, still a bright sky will be found. We'll have through the afternoon. And the early part of Saturday, I do anticipate that into the GTA we'll actually have some decent conditions. It's into the afternoon. Things will begin to change and some showers and a few thunderstorms possible. Then it becomes more organized and more widespread as we go Saturday night and into Sunday. So that will be kind of the wetter day for many, the last day of the March break. So those are the conditions to anticipate. Overnight tonight, the temperature in Toronto will slide just below freezing, so -1 to start out tomorrow morning. But into the afternoon, don't worry, another mild day with that sun coming at you, a high of 9 degrees and some teens to be found in the weekend, even if it comes, Kelda, along with some wet weather, and by Sunday, some breezy conditions as well.
Great. Thanks so much, Colette. And that is our show for you tonight. Thanks for joining us. Have a great night, everyone.